And one thing I'm looking at too is we think a lot about voice. Voice is the most human way to engage, whether it's with a machine or a human, right? It's this something
doing
that
it now.
we're doing it right now.
Right.
And understanding voice is an opportunity for creative. That is probably the biggest opportunity right now in creative. Are you seeing some of that pan out as well?
Not really. So that's the uphill battle that we have at the moment, right? So you're spot on, right? Voice is a massive opportunity, and these guys are going, "What are you talking about?" Right?
Yeah.
Because I think it's a completely different interface, and everybody is unique in the way they talk. So one of the examples we show is a demo that we built that basically takes us utterings and our ahas and our hmms and things like that, and teaching the machine the differentiations between those in Texas versus Missouri versus Alabama, right?
Yeah.
So that the creatives can get their head around. It's not too different to copywriting. When you're writing copy, if you're going to do it for Alabama, it's going to be completely different to what you're going to do for Canada. So it's the same process. But getting your mindset around it and your head around it is really tough.
Yeah.
The big area that I think, the low-hanging fruits for voice search.
Yep.
Nobody's talking about it. But 70% of search in Asia is voice search.
Yep.
What's the nearest thing to me? So if you don't have the tags and the semantics built into your content, you'll never get a result.
It's not searchable. No. Exactly. You can't actually query anything.
Exactly.
I totally agree.
What are you guys doing in voice? Is it the Cortana platform?
We have Cortana. We have our natural language processing within Lewis, and then we also have our custom speech service, which I think is incredibly powerful because in a medical context, a lot of these words that you're getting pre-baked out of NLP platform are not medical terms, right? They're very unique and differentiated, and I think that organizations need to look at and understand the capabilities of using something like custom speech technology in order to get those phrases and utterances in order to build out that platform, right? If you're going to have a voice experience for a doctor who's doing surgery, and he might be talking about different parts of the human body, and it calls up to a voice cloud service, they might not have all of those pieces.
Yeah.
You need to train those models. And I think that those are the type of things that we're showing that it's so broad, right? We say custom speech, you can do anything with it. And I think that almost becomes a non-starter because organizations without creative and without the ability for an organization like a partner to come in and help them, they go, we can't even think of where to begin. Yeah. There's just so much we can do.
Well, health is even tougher because you've got two audiences. People don't talk in medical terms. My finger hurts.
Yeah.
I've got a pain in my rib.
Yeah.
You've got to convert that. Well, oncologists and endocrinologists and all the ologists all talk different languages based on their particular area of expertise. So the oncologist is really going to talk about cancer and all the different mutations and tumors and very medical, right?
Yep.
So you've got both to cater for.
Yeah.
And then how do you connect the two?
Yeah, right? And the challenge is one consistent voice experience won't necessarily work for both of them because both of them are going to end up needing different pieces of information.
Exactly right.
Totally.
So the speech services, is that customizable? That's how it works?
Yes.
Oh, right.
Yeah,
okay.
So the way that it works is you put in a term, like, you get a phrase from an oncologist, you put that information into our user interface for the custom speech service, and then people are able to, as the service is collecting this information, either say that is a positive or a negative inference with the phrase, and then you train it over time. So I think that especially in unique industries such as healthcare, it's an incredibly powerful tool. But the big piece comes back to how are creatives able to design using that tool? And the unique thing with voice as well is that the teams that need to be around voice are a copywriter, UI, UX designer, and a software engineer. And those people may have never talked to each other before. But
Especially
in order, big agencies, exactly. And those are also people that no healthcare provider or healthcare system probably has on staff. So there's a huge importance on the agency side to come in and do this. But the challenge is, how do you get everybody in the same room together in order to have that creative inspiration to build something?
So if you look at all of these things, they all have one sort of thread going through them, right? Which is new engagement models that are being enabled by the mobile device primarily, right? The power that the mobile device has. location-based services, that sort of stuff. So you've got voice, you've got chat, you've got natural language processing, image recognition and search.
Yep.
And then you've got mixed reality with HoloLens
Oh
coming
yeah,
through as well,
which is
right?
massive in the healthcare space.
Right. I mean, the great work you did with Great Western University
Yep.
in changing the way we educate future doctors.
Yeah.
Really cool stuff, right?
Yeah, because you build AR mixed reality as
Yeah.
an empathy machine,
Right.
is what I jokingly phrase it. And when you're a doctor or training to become a doctor, the ability to see the human body in front of you and interact with it with natural gestures, right? Because it's not like you see a patient and then you pull up a cursor and you start clicking.
That's right.
You actually go and you feel their shoulder because
Yeah.
they're telling you that it's hurting. And what you're able to do is come in and be able to build that empathy and understand what that experience would look like should that become a real patient.
Have you done anything around haptic touch with that then? Is there
I know
anything
there's
around
startups
that?
in the space for
Yeah.
sure. I don't think we've actually done a lot. I know that we have some cases that came out of our technology where a woman had so much trouble with her hand. We ended up creating a piece of technology using our AI, not natural language processing, machine learning, that was able to normalize and
Okay, so it's like a
stabilize
band
your
that
hand.
you put on your arm.
Exactly. It was something that came out of Microsoft research,
Right.
which again comes back to when you start to incorporate something like IoT into the mix and you start applying AI models to that, you can do incredibly powerful things when it comes to healthcare.
So going back to the creative software engineer, copywriter thing,
Yeah.
I think the other model that we're shifting, that we're looking at, is not your traditional copywriter either. You can't take a copywriter who's been writing copy for posters or TV and turn them into a voice writer. It's
Yeah.
really difficult to do. So we're actually looking at different skills. What we're finding is people who wrote scripts for call centers, for example,
Interesting.
are really good in healthcare.
Yeah.
Because healthcare is very scripted, right?
Yeah.
Everything we do is scripted. So we're hiring people who wrote scripts for the call center model and the call center teleprompter and using them to write these scripts because they've been using these scripts to interact with people already,
Exactly.
right? So they understand that metaphor, which is quite interesting. So it's not your traditional copywriter.
Yep.
It's these new guys who are coming through. We're also using a lot of folks that do work in cartoons and comic books because they have to come up with a conversation in 9 pages very, very quickly.
Yeah.
So can we do the same thing here? Because it is that.
Yep.
You're not going to interact with a voice thing for about an hour. It's a very quick thing, right?
Yes.
Hey, I need help with this. Okay, what do you need? I can get it for you. That sort of thing.
Yeah.
So comic book writers have to do that.
Yep.
So it's those kinds of new skills that the agencies have to think about as well as they deploy these new technologies.